unusual professional wrestling injuries. Josh Briggs, Goldberg, and X Pac. How they got injured and what made their injuries so freaking unusual. Stay tuned to find out. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your number one stop for information on orthopedics and sports medicine that's easy to understand for everybody. Okay. If you want to know more about my life as an orthopedic surgeon, be sure to follow me on Instagram or Twitter at Stable Knees. I'm also on TikTok at Dr. Raynor. If you're looking for information on workouts, exercises, or tips on injury prevention, don't forget to check us out on our sister channel on YouTube, Human 2.0. And by the way, I'm on a mission to teach everyone about orthopedics and sports medicine. Help me accomplish this goal by sharing this video with anyone who you think might be interested in this topic. That being said, let's get to watching the videos. The first unusual wrestling injury involves a wrestler named Josh Briggs. Josh was injured on March 18th of 2019 in a match versus A.R. Fox in Queens, New York as part of the Evolve 124 promotion. At the end of the match, Briggs attempted a top rope choke slam backbreaker on Fox. That's right, I said top rope choke slam backbreaker. That's a freaking mouthful. As they fell on the ground, Fox fell directly onto Briggs' knees, with Briggs rolling away to his right-hand side. Immediately, Briggs appears to be in distress, with his left hip and knee held in flexion. As he lays on the ground, you can see that his left hip is adducted towards the midline, and this just means that his knee is pointed towards the other side of his body. He attempts to slap his knee outward, leaving some people to believe that he actually had a problem with his left knee. However, he appears to be unsuccessful in his attempt to correct whatever is wrong with his knee or his hip. He is unable to waver on his left leg, and he is helped out of the ring on a stretcher. Later that evening, Briggs tweeted from the hospital after his left hip had been apparently reduced and placed back in joint. And this just means that the physicians gave him some kind of sedative or conscious sedation, and they took the hip and put it back into joint using manual traction. Briggs went on to indicate that he would likely be out of commission for approximately 2 to 3 months. In his feed, he posts a video of himself ambulating with crutches in the hospital. Normally, a blow to the front of a flexed knee is the typical mechanism to cause a posterior hip dislocation. This is the same mechanism by which quarterback Tua Tagovailoa was injured in NCAA football late in 2019. If you haven't watched my video on that topic, you can do so after watching this video. I'll leave a link down in the description down below. The acetabulum, or the cup of the hip, is typically tilted at 45 degrees and angled towards the front of the body by 15 to 20 degrees. When the hip is flexed and adducted, meaning with the knee angled towards the midline, a force that is applied to the front of the flexed knee can force the hip out the back of the joint, causing a posterior or backwards hip dislocation. In some cases, this may be associated with a fracture of the back of the cup of the pelvis. When a posterior hip dislocation is associated with this type of fracture of the acetabulum, this is referred to as a posterior fracture dislocation of the hip. In Briggs' case, he was fortunate and he only suffered a posterior dislocation of the hip without any associated fractures. Nevertheless, a posterior hip dislocation is an injury that requires a reduction in a hospital setting, typically under sedation. It usually cannot be reduced in the middle of the ring, and especially not by slapping yourself on the side of your legs. Do not try this at home. Rehabilitation is usually extensive, and if no fractures or labral injuries have occurred, can last between 2 to 3 months before the patient is able to return to regular activities. Fractures and other associated injuries such as labral tears will increase the duration or the length of rehabilitation. Ultimately, Briggs was able to return to wrestling in May of 2019 at the C4, the Filth and the Fury promotion. The next unusual injury suffered by a wrestler includes one that happened to a wrestler named Goldberg. Goldberg was injured following a WCW match in 1999. After chasing Bret Hart out of the arena following Starrcade 1999, Goldberg decided to demolish a limo parked outside of the arena out of frustration at his inability to find Bret Hart. Goldberg had planned to smash the windows of the limo with a small metal pipe that he had hidden in his clothing. But shortly after starting his performance, the pipe flew out of his hand, and he was forced to add it. This did not turn out favorably for Goldberg. He decided to continue his performance using his hands to smash the vehicle. We can see that after smashing a few windows, he quickly glances down at his hand and wrist, but he continues on with the performance anyway, because you know, the show must go on. When he moves on to smash the hood of the limo, we can see a large, and I do mean large, a large splatter of blood on the hood of the car. Although he continued with the bit until the end, it was not without significant injury to his right wrist. It turns out that Goldberg suffered a laceration to a tendon and an artery on the ulnar aspect of his right wrist. This is an injury similar to those suffered by Cal Clutterbuck and Ilya Mikheyev in the NHL earlier this 2019-2020 season. If you haven't seen any of those videos, be sure to check them out after watching this one. I'll leave a link in the description down below. Goldberg states that he suffered significant blood loss as a result of this injury, so it is likely that he lacerated both the ulnar artery and quite possibly also the flexor carpi ulnaris tendon as well. Following the performance, Goldberg was taken to the hospital emergently. He underwent a tendon repair and a vascular repair after this injury. He was forced to miss 6 months while he rehabbed after his surgery. Goldberg returned to wrestling on an episode of Nitro in May of 2000, and he went on to wrestle for some time thereafter. So let's move on to the final one, and this one is the strangest one of all. The final weird wrestling injury that we are going to discuss includes a wrestler named X Pac. Kind of like the rapper Tupac, but with the letter X, and not a rapper. This injury occurred on March 25th of 2013 in an indie match in Minnesota. During the match, X Pac attempted to perform his signature move, the Bronco Buster, on his opponent, Horace the Psychopath. The Bronco Buster. Who comes up with these names? While attempting to perform this maneuver, instead of landing on the padded turnbuckle on a 45-degree angle as he had planned, he instead landed horizontally on an exposed metal portion of the turnbuckle. He immediately grabbed his groin and his buttocks after the maneuver. Although he was clearly in distress, he was able to continue the match to completion. Not only was he able to continue the match, but after the match, he was apparently able to attend an after party, but was forced to leave as a result of ongoing hemorrhage from his nether region. By that, I mean bleeding from his anus. X-Pac had apparently suffered a laceration of his anal sphincter caused by the exposed metal of the turnbuckle. Now, the sphincter is a structure that provides control of your rectal evacuation and your bowel movements. Damage to this structure can cause involuntary flatus and even fecal incontinence, meaning you might fart or poop uncontrollably, not when you want to. That doesn't sound very pleasant. Following his departure from the after party, X-Pac presented to the hospital, where he underwent a physical examination by the attending emergency room physician. He was subsequently admitted to the hospital, where he underwent emergency sphincteroplasty to repair the muscles of the sphincter in hopes of restoring normal sphincter function. Because you don't want to fart or soil yourself involuntarily. Although I don't think you really want to soil yourself voluntarily either, but so that you could restore control of the rectal sphincter. X-Pac claims that he nearly died as a result of the blood loss that was associated with this injury. However, I'm skeptical that he would have suffered hemorrhage severe enough for this to happen. As a sphincter is a muscular structure, one might expect some degree of spasm or clenching down of the muscle and the associated blood vessels as a result of the laceration of the structure, which would decrease bleeding to some degree. While it might appear that the bleeding is uncontrolled initially, at some point that bleeding would slow down as a result of muscular and vascular spasm. Regardless, X Pac went on to have a successful repair of his anal sphincter. Thankfully. We can all breathe easy knowing that X Pac will not have involuntary flatus or evacuation of his rectal contents. After surgical repair and recovery, X Pac was able to return to wrestling later that year. He continued to wrestle until his retirement in 2019. With wrestling being an extremely physical form of entertainment, injuries are commonplace. However, on occasion, some of the injuries that occur can be quite strange and unusual. These are only 3 of the strangest injuries that have occurred during professional wrestling. If you know of a strange wrestling injury that I did not cover in this video, be sure to let me know in the comments section down below so that I can cover it in a future video. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.